Welcome to the neXendo method, created to break down the science of sustainable health into real actionable items through the lens of nutrition, exercise, and endocrinology. I'm your host, Kathy, co-founder of neXendo Wellness Program. Let's start with the basics. What's actually happening in the body when somebody is taking a GLP-1? And why is rapid weight loss a double-edged sword?
So GLPs are a class of molecules that are called agonists, which means that they mimic a process that naturally occurs in our own body. So when we eat, a hormone is released from our stomach, and then it stimulates to the brain that we're feeling full and satisfied. It delays gastric emptying, which means it delays the rate at which our stomach empties the food. And then it stimulates our pancreas to release insulin. So the end result is that people end up feeling satisfied earlier, fuller longer, and have improved insulin levels. As a result, people end up reporting that they have smaller portions, they're snacking less, they feel really satisfied, and just feeling overall in control of their choices.
Joe, why do you think it would be rapid weight loss would be a double-edged sword?
Hi, Kathy.
Hi.
Hi. So after taking the GLP-1, one of the most common side effects is you will lose body weight, which is what most people are expecting. But what is actually losing the body weight? In a research from 2021, it shows that people using the GLP-1 will lose about 15% of total body weight in about 16 to 17 months. However, there's going to be about 39 to 40% of that loss from lean mass.
Oh, wow.
So your muscle is technically your metabolic active tissue that without muscle, it slows down the metabolism.
Makes sense.
Yes, with less muscle, you will burn less calories. So muscle isn't just something that looks good on your tank top. It helps you to burn more fat.
Mm-hmm. So by losing, you're losing the lean body mass when you're on a GLP-1.
Correct.
It doesn't help. That's how it's a double-edged sword. I get it.
Decrease your metabolism.
It decreases your metabolism. Right?
Exactly. And not to mention bone density loss,
Mm-hmm.
which is the by side effect after losing muscle mass.
Got
So
it.
people who are over 40 years old, they should be more careful if they're losing muscle mass.
Right, because then that could lead to other ailments like osteoporosis.
Osteopenia.
Correct.
Correct.
And then we become more fragile. It's like a snowball effect. We become more fragile. We might fall. We might fracture, et cetera, et cetera. So people don't actually realize that if they don't encompass all three things while on a GLP-1, they're running a risk of all of these additional issues.
Yes.
Okay. All right. So I've heard that protein is crucial for GLP-1 patients. Why is that?
So protein is important for everyone across the board, but it's especially important when you have a decrease in energy intake. So you're not really eating as much, or you're not getting as much of those hunger signals as often. So every bite really, really counts. Protein is important because it preserves skeletal muscle mass. So like Joe was saying, you want to protect your metabolism. You want to protect the risk of long-term injury, prevent the risk of developing osteoporosis down the line. Additionally, it also helps stimulate that fullness signal, so it improves satiety and also helps with blood sugar regulation. So it not only helps with managing your current goal, but it helps a lot of other metabolic processes too. So not just supporting weight loss, but your overall health.
So to add on what Sasha just mentioned, without poor nutrition, you can't out-train with poor nutrition. Your muscle needs fuel to maintain and grow. Without sufficient protein, resistant training will deliver results.
Mm-hmm. Resistance training.
Yes.
Interesting. Okay. So how much protein are we talking about? What happens if you fall short?
So individual needs vary, but we typically look about 1.2 to 1.6 grams per kilogram. But it's really important to meet with a registered dietitian, a licensed trainer, or medical professional to assess your individualized needs. Like Joe mentioned, it's very important to make sure you're getting enough protein and other nutrients to support muscle synthesis. But we also want to make sure that we're supporting your overall picture of health. So if people aren't getting enough protein, they might have decreased muscle synthesis. They might report feeling more tired. They might notice hair loss, brittle nails, and just feeling really fatigued. So we want to make sure that we're really supporting them along this journey.
So just to put a little wrench in here, but I want to ask a question, right?
Yes.
I mean, I have had friends who have literally had a fight over a piece of chicken because they needed to get their protein intake for the day.
Mm-hmm.
Now, obviously, these two individuals were arguing because they were bodybuilding, right?
Mhm.
But if you fall short maybe like one day, is it going to make that much of a difference here for people that are on GLP-1? That's my question.
It's important to be consistent. And so that's why we work with them to set these goals. If there's a day where they fall short, it's not going to significantly impact them. But we do want to make sure that we're setting up a good routine to help individuals stay on track to make sure they're hitting those goals.
Got it. And would you like to add anything to that?
What happens when trainers don't get enough protein?
To be honest, it doesn't affect if it's just one day fall short.
Right.
It's more about a whole week. Are you averaging that sufficient amount of protein?
Yeah, being consistent.
Being consistent, correct.
I got you. Okay. So I want to get into a little bit about resistance training.
Sure.
And how I feel that resistance training is a non-negotiable when you are doing this.
Mm-hmm.
Why is it you feel that people should not just focus on cardio and diet?
Okay, so for sure, cardio would burn more calories to compare with resistant training. But at the same time, doing resistant training will give the body a signal of knowing what to preserve. If you're not doing enough resistant training, that would affect the muscle mass retention, and then that would affect the metabolic rates that we mentioned earlier.
Oh, interesting. Interesting. And so what does a typical GLP-1 patient training program look like?
So based on what ACSM, American College of Sport Medicine, and also WHO recommend, people have to do more than 2 times, ideally 3 times of resistant training a week.
Okay.
And during the weight loss phase, it would be better if you can do more than 3 times of resistant training to give in the body more stimulus. In terms of resistant training, you want to give the body 2 times a week on the major muscle groups to making sure that it maintains the lean mass.
Got it. Okay. So overall, resistance training is essential, not optional.
Correct.
And that's one of the key things here that we try to instill in our clients in the neXendo Wellness Program. To help them understand that it's not just taking that one shot a week. You have to incorporate nutrition and you have to incorporate exercise. Part of that exercise, as you said, resistance training.
Correct.
Key.
Yes.
Excellent. And what type of a program structure would you give someone that's resistance training 3 to 4 times a week?
Okay, so let's do the math. Based on, backed by a study by 2018, to preserve muscle mass, it's better you stimulus the muscle not only 2 times a week, but ideally 6 to 12 sets on every muscle group. Mainly the main muscle group like chest, back, legs. These are the muscle groups you will try to preserve. You want to do compound exercises over just isolating exercises. So movement like a squat, a deadlift, a push-up, a bench press will be something more beneficial to compare with exercise like leg extension, like just a lat pull down or just a pack fly, something like that.
So that's why it's always a set of 12. Wow, thank you. I just got that.
Yeah, so let's say if your split is 3 times a week or 4 times a week, if you do 3 times a week, you want to make sure that you do 4 sets each day. If you do 4 times a week, you want to make sure you do 3 sets each day on the main muscle group. So that's the reason why.
And what are the things that you would say typically that we need to try to avoid?
Okay, so the things that you need to avoid is not loading enough stimulus without enough progressive overload that you're going to start the process. You have to make sure that you increase your volume, the intensity week by week, so that making sure that the muscle not also retenting your muscle, but at the same time you grow muscle mass.
Okay. So excessive cardio without resistance training.
I have patients that do that.
We try to avoid that, right? We want to try to avoid that excessive cardio without the resistance
Oh,
training.
yes. Okay. So you should also avoid excessive cardio without resistance training. So you always want to prioritize resistance training first, then cardio.
Okay. And calorie and protein intake, what would we try to avoid? Training on severely low calories without adequate protein.
That's a good question. So you have to make sure that you are progressing the progress week by week to give enough stimulus to the muscle to maintain the metabolic rates. And then try not to do excessive cardio without resistance training. You always want to prioritize resistance training first, then cardio. And then make sure you have adequate protein intake and don't ignore recovery.
What
Okay.
should a GLP-1 patient's training program look like?
So first off, based on ACSM, American College of Sport Medicine, WHO, they recommended that you have to at least train 2 to 3 times a week. If you're in a drastic weight loss program, it has to be more than 3 times a week. And then you have to do at least 6 to 12 reps on the major muscle groups each week, which means if you're doing a 3 or 4 day splits, if you're doing 3 day splits, you want to make sure that your muscle groups has 4 sets of everything for the major muscle groups. If it's a 4 day splits, it's gonna be 3 sets on everything for major muscle groups. And you want to focus on compound movements instead of just isolation movements. Compound movements such as a squats, a deadlift, a bench press, or a push up instead of a leg extension, a lat pull down, or just a pull over exercise or a pack fly. So you want to base on that and then do progressive overload. You want to make sure each week that you increase, no matter its intensity, no matter its volume, week by week to build up.
So when we have a client that is on a GLP-1 and they are talking to nutrition
Mhm.
and they come to you for advice as a trainer and you tell them all of this wonderful stuff that you just told us, what are some of the items that we would let them know that they would need to avoid?
So first off, you want to do cardio, yes, but not excessive cardio. You want to prioritize resistance training first, then cardio,
Got it.
and make sure that you're in sufficient amount of protein based on what Sasha just mentioned. And then don't ignore recovery. If you need to take a day off and rest, please take a day off and rest. Anything you want to add up?
Okay, so to add on to what Joe was saying, it's really important to make sure that you optimize your nutrition intake. We want to make sure that you're getting enough protein to help build your muscles, stabilize your blood sugars. We also want to make sure that you're getting other nutrients that add as cofactors like magnesium, calcium, phosphorus. All of these things work together to really support your muscle synthesis, but also supporting your immune system, making sure you're getting enough energy throughout the day. Very often, I hear that individuals feel super low in energy, so they don't want to work out. And so we need to make sure that their nutrition is consistent, that they're getting everything that they need to really support their weight loss, but also preserve their overall health, whether it's their muscles or immune system, to support the wellness journey.
And what about when
Drink
somebody
water.
comes and, tells you, oh, I've been to nutritionists before and everybody tells me to just cut out carbs and, it's like, and I'm carb counting. And what do you say to people?
So what I do is I first gather the patient's history and I gather their current diet recall. So I get a sense of what they're doing right now. And then I talk to them about the recommendations that I feel that are suited for them and talk about ways to support their intake through that lifestyle. So carbohydrates are very important. Carbohydrates are our body's primary source of energy. When we're doing strength training, we need carbohydrates to help build that muscle and also help with recovery. So I talk to them about the types of carbs that they need. So we tend to just put a blanket statement over all carbs. So I talk to them about the types of carbs that they need, the portion of the carbohydrates, and how to pair that alongside protein to help support their goals. And then to make sure that they're getting the other nutrients that they need, whether that's calcium, phosphorus, potassium, water actually is a big one. So with these medications, people don't really have either, don't their phrases. What I often find with these medications is that individuals are not meeting their hydration needs. And so they come up short, which increases the risk of injury. Water is also important for portion control, just supporting our overall health. So it's important to make sure that we stay consistent with their fluid intake too.
So, my takeaway from all of this, if I may, is that when we are speaking with clients, we're assessing each client individually. It's not a cookie cutter program that we provide. So, we assess them individually and we meet them where they are. What I'm also getting is that both nutrition and exercise play a very key role in weight loss. I'm not the expert. Correct me if I'm wrong, right?
You're right.
But everything is intertwined and you can't have one without the other. So you need to, like, I know from my son that you carb up before you go to a workout and then you protein after the workout, right? So that you can do the recovery and that you can have enough fuel to do the workout. Is that correct?
Yes.
Joe, as a trainer?
Yes.
Right? So my son has taught me at least that, right? So the individuals that are on a GLP-1, when they're doing all of this, they need to know about the nutrition and how to do and what to do in order to do the exercise portion.
Exactly.
So the strongest evidence that we have to support individuals on their weight loss journey, but just supporting their overall health, is diet and lifestyle. Yes, in addition to the GLPs, you get greater outcomes with diet and lifestyle, but it's really important to focus on this because these medications are intended to be complements to diet and lifestyle. And what sets us apart is that we provide this individualized care, but we also use specific data. So we have the metabolic rate test, which measures an individual's specific metabolic needs. We do a body composition analysis. So we looked at the percentage of fat, bone, and muscle. So a lot of people come in and they're like, I've gained X amount of pounds over the last year, even though I'm exercising 5 days a week. And so that is a really useful tool for us to say, like, yes, you may have gained some fat tissue, but you've actually also had a significant increase in muscle mass. And so we work with individuals on a very personal basis. So we're able to tailor each plan to that person's specific needs because diet and lifestyle is not a one size fits all, no pun intended. It is very individualized. And that's where we also meet them where they are.
Yeah, that sets us apart from everybody else.
Yeah.
Joe, you want to add to that?
The only thing I want to say for GLP-1 medication is it is a tool, but a tool needs strategy.
Oh,
whoa, my God. 3-point shot. 3-point shot. I agree with you on that. You know why? Because, most people say, I want the GLP-1 because they think that it's just the medication and they could just go on eating whatever they want to eat, or then they're going to feel full, so they're not going to eat or whatever, but they forget about everything else.
Yes.
And I feel that is very important. This is what sets us apart. You very importantly said of what testing we like to do in our facility. We need a baseline. We need a baseline. When somebody walks in, we need to know where you are in order for us to be able to meet you there. And we do, like I said before, we do a full assessment, not just baseline in terms of the testing, but what your goals are. Like, what do you want in 6 months? What do you want in a year? Where do you see yourself? What is the most concerning to you? Is it you want to feel better? You want to age better? You want to be 60, 70 years old and you want to be able to keep moving? Or what exactly is important to you? And I think that we focus on everything holistically. We look at everything. Very important.
Yes.
Yeah. So I wanted to touch on the risks of being on a GLP-1, the risks that nobody talks about. What are the real consequences if someone is on a GLP-1 and they don't prioritize muscle and bone health?
From a nutrition standpoint, it goes back to the point that it's really important for individuals to make sure that they're getting their protein needs and their overall energy needs, because we want to make sure that we're supporting that muscle synthesis, that they're supporting their bone health and getting the other nutrients that they need. If they're not meeting this, then their body's not going to have enough tools to build this and support their overall system. So they just increase their risk for losing their muscle over time, which can lead to bone loss over time, and then just others factors that may happen. So losing hair, brittle nails, a depressed immune system, having low energy. So we want to make sure that we stay ahead of this to just get a good system in place to make sure that they have the tools in their toolbox for their journey.
So as per training standpoint, muscle loss, bone loss is not something cosmetic. It's also functional. If you are not working out enough or you're not building yourself strong, you would have weakness that affect your quality of life, like climbing stairs, poor grip strength. You're not able to have your groceries. You won't have the stamina to play with kids, grandkids, and you just put yourself in a higher risk injury. And we want to be as independent as we can when we age, and not prioritizing training and using GLP-1, which give you muscle mass loss. Bone mass loss would lead you out to a consequences. Yeah.
So before I get to my next question, what I really wanted to say is that people nowadays, they focus on, oh, they want to look good, right? And the look good to them is not to be overweight. But what they're forgetting is that you need to look good, not only on the outside, but you need to look good on the inside. And that's where, again, the nutrition and the muscle maintenance comes in. Based on what we discussed before, if they're not prioritizing muscle and bone health, do you feel that the damage would be reversible?
For resistant training, it's never too late to start. And once you start, you progress upon that. It's always reversible. But for bone loss, it takes a lot more time to reverse. So you better prevent it when you can before it becomes something more damage.
Yeah, I mean, for bone loss from, a pharmaceutical point of view, once you go down that path where you have osteopenia and osteoporosis, I mean, this would be another podcast in and of itself.
Yeah.
The point is to try to prevent to get to that point, because once you do, yes, there are medications that are provided where they can help build bone, but the objective is not to get there, because it'll never be how it was prior to this happening.
Exactly. You don't want to risk yourself to get bone fracture when you get less bone mass density.
Right. Yeah. Sasha?
So inadequate intake can lead to deficiencies, and you can restore those deficiencies. So whether it is B complex vitamins, iron, calcium, but as you both touched on, it's a lot harder to come back from that. So the best thing to do is to stay ahead of that and make sure it doesn't happen. Because once you get to the point of osteopenia, osteoporosis, at that point you're working to delay the progression of it. And so it's better to stay ahead of that. In addition, you want to minimize the side effects that you have from it. So if you're not getting enough nutrition, you're going to feel low energy, you're going to be less motivated to do things. You're going to have hair loss, you may have a weakened immune system. And so these are things that impact your day to day. So we want to make sure that you stay ahead of it before you even get to that point.
So it would be a safe statement to make that as a program, we focus on being proactive rather than reactive.
Absolutely.
Yeah.
Would you agree with that?
Yes, totally.
Okay. So we want to let our clients know that it's not about fear, but we want to empower them in a way of how to live their life. Small, consistent actions make massive differences, and it's never too late to start. Let's make this practical. If someone who is on a GLP-1 is listening, what should they start doing today?
From a nutrition standpoint, hydration. That's the easiest and one of the most important things, making sure you're adequately hydrated. So I just have individuals have a reusable water bottle just on their line of sight to remember to drink enough. Setting alarms. So sometimes those hunger cues, we might not be as in tune with them when we're on the medication. So just a reminder to eat every few hours. If you're working on a computer, setting a Google Calendar reminder. And in order to meet some of those protein goals, the simplest way I say it is just having some sort of protein every time you eat. So maybe in the morning, instead of just fruit on its own, it's yogurt with fruit, or you do hard boiled egg and toast, or a protein shake or protein bar. Even if it means leaning on convenience first, just having protein every single time that you're eating to make sure that you're working towards those goals.
So based on a training standpoint, first off, you want to at least schedule 3 to 4 times the training sessions if you already have experience. But if you start new, it's okay to start with once a week and then slowly progress up to twice a week. Ideally, you want to eventually do 3 to 4 times a week. It's okay for start without weights, just with light weights, body weight. Just start where you're at, and then after that, prioritize the progressive or load. You want to add up weights and reps weekly. You want to make sure that the intensity of it is at the RPE 7 to 9, which means, let's say if you're planning to do a 10 reps, you want to make sure that after the 10 reps, there's only 2 or 3 left in you. And make sure that you have enough intensity so that by progressing over that, you will see the results. And then don't fear of thinking of persistent training will get you bulky, especially where you're on deficits. You want to track your performance, not just the weights. You want to check out your energy level, your strength, and see how your clothes fits. If you're gaining weight or maintaining weight, but your jean size is looser, which is great. Yeah. Right.
So I gotta say, Joe did a training with me, like he was training me a couple weeks ago. Boy, let me tell you what you said. Like, do the 10 reps and then have just 2 or 3 left in you. Boy, did you work me hard that day. But it was good overall. I loved it.
Thank you.
I did. He's awesome. Yeah.
I have 2 questions actually. These are 2 things I hear from my patients.
Okay.
So the first one is how you talk to individuals who don't want to get bulky. Like I have individuals that say that even though they know that muscle is good for them, they just don't want to see the scale go up or their clothes size go up or just even look bulky. And so it sometimes can be hard to encourage individuals to strength train. They know that it's good for them, but they just don't want to see that. And the second thing, I think that we should talk about how important the exercise is, because I have people that say I don't want, quote, Ozempic face or saggy skin or like the sagginess is the big thing that they're trying to avoid. So how important is exercise for that?
Okay, so first thing first, remember you're under a deficit. To be bulky means you will need more energy than the deficits or the maintenance to be bulky. So physiologically, you are not getting bulky if you're under a deficit. And secondly, if you really have the concern of getting bulky, let's talk about hypertrophy. So hypertrophy as a term is a phase of when you do this amount of lifting that helps you to grow more muscle mass. And that lane is in between 8 to 12 reps. If your goal is to set up to toned or to get stronger, you want to set up the weight range more than 15 reps for endurance, which you give you more tone, a little less bulky. And then on the other side, if you're building out strength, you're aiming for less than 6 reps. That also makes you less bulky. But overall, most importantly, it's more about the deficits.
So if I eat under but still exercise, I can stay lean. But if I'm eating just as much but doing those types of exercise, I will bulk up.
Correct. Yes.
Okay.
But if you're eating less, you're not eating enough.
So the way I'm taught and the way I recommend is that you're adding in, so you added the protein and the carbs. One, you add it around your workout, so the carb before, the protein, the carb after, but it's still in a deficit. So if you burn 300 calories when you're exercising, you add back 150. If you're burning 100, you add back 50. So you're still adding the calories, but you're still in a deficit.
Yeah.
Is that right? That's
Yeah, correct. Yes. You need more calories to build more muscle mass.
Mm-hmm.
So it's difficult to be more bulky
Mm-hmm.
under deficits. That's what I meant.
Mm.
Yeah.
Makes sense. That makes sense.
We know people that are on keto. We know that people are like hardcore keto and won't eat any carbs. That might be even a little bit lower in protein. Do you see how that impacts their muscle synthesis?
Um,
Or do you have keto patients?
I do not have keto patients, but to get in keto,
Mm.
you have to stay out of carbs for amount of time, and then that will lower down your energy system first,
Mm-hmm.
and then once the body get into the keto phase,
Mm-hmm.
it will start using more fat to give in energy instead of carbs. I do not encourage keto, to be honest, because carbs is your main fuel in terms of energy.
Mm-hmm.
If you are not loading enough carbs, it's difficult to do a lot more intensity progressive overload.
Second question was about, I don't know if there's a nice way to put this, but like Ozempic face. So a number of my patients are concerned that with the rapid weight loss, they will experience like sagging skin, wrinkles, or even just like sagginess in areas where they've lost weight really fast. How do they combat that?
To be honest, that is a tough question.
Yeah.
Because if, let's say, you lose like 50, 60 pounds in a really short period of time, no matter how much you lift, you will have sagginess of the skin if it's fast and it's a excessive skin.
What if I don't exercise during that time? What if I just drop the 50 pounds? Will it be worse?
It would be worse if you're not doing any workouts. Resistant training tone up the muscle mass. It would give the muscle more definition. So when you're losing fat, your skin, I actually don't think this is like a
science-based thing?
Yeah, I don't
Yeah.
think this is a science-based thing.
Oh, okay.
Yeah.
Okay. Wait, which part?
I mean, like, I'm not skin expert.
Oh, yeah. Okay.
But just to like add to that, how is, for lack of a better term, because you also said that yourself, Ozempic face, any different from the face they would have if they had bariatric surgery? The saggy skin would be there. Then this is just opinion based.
Yeah.
Okay, not science based. This is just a conversation, right? But if you went and you had bariatric surgery and you dropped 50, 60 pounds, would you not have sagging skin? Unless you have plastic surgery, you're going to have sagging skin. So whatever we would do in that situation, we would probably do with someone that's on Ozempic. I think with resistance training and helping, again, this is just an opinion, it would help minimize what that looks like. And, there's always there's facial exercises that you can do. People even do it now that don't lose weight because they don't want to start looking old, where they keep their cheekbones high, they keep their jawline fine. Thank you. So that, I think that's like a different topic altogether.
Yeah. I guess I was just trying to sell the exercise thing. But I don't know.
But overall,
Because actually I did have a patient ask me.
it's really interesting that you asked that question. What I was hearing as you were asking those couple of questions is a person is concerned with their image. And another part of our program is the fact that we have a social worker on staff who can assist and see these clients in order to help with the image persona.
The social behavioral aspect of it is a very big aspect of it. I don't know if this part can go into it, but I tell people that I'm also a therapist. Part of my role is being a therapist because food is very entwined with emotion. So people feel depressed, they eat. They feel stressed, they eat. They feel happy, they eat. They celebrate, they eat. They socialize, they eat. So it's very, very entwined with that. And so it's very important that while you do focus on the diet and lifestyle, you also have other support around you, whether that's through your family members, your friends, or us, again, providing the structured support through a licensed social worker. So again, that's what I might be biased, but I feel like that's also sets us apart. We have all the tools to help you through this journey: medicine, nutrition, exercise, and social. So all these different factors to help you support you through that. So I certainly believe that the social work aspect of it is a very important aspect of it.
Here's the bottom line. GLP-1 medications are powerful tools, but they work best when they're paired with the right nutrition and training strategy. You're not just trying to lose weight. You're trying to lose fat while keeping the muscle and bone that keep you strong, healthy, and vibrant for decades to come. Huge thanks to Sasha and Joe. Thank you, guys.
Kathy, for having us.
Thanks so much.
Thank you, Kathy.
Thanks for breaking this down. If you found this helpful, subscribe to the neXendo Method podcast wherever you listen, and follow us on socials at neXendo Wellness for daily tips and insights, or click on the link below.